Dear students, today we are going to discuss about the effects and implication of deaf blindness and activities of daily living and education. Deaf blindness is a unique kind of disability. The combination of vision loss and hearing loss affects the way in which the child learns. In the absence of two distant senses, child has limited opportunity to have knowledge about the environment around him. His world shrinks to the fingertips. Isolation becomes more profound for these children, which results in passivity. Bonding with the mother becomes extremely difficult for them. Most of these deafblind children have additional disabilities as well as like mental retardation, cerebral palsy, physical disability and autism. For these children, communication becomes very difficult as they have a problem in hearing and seeing and registering, understanding and deciding the strategy for responses. Some deafblind children who do not have any other additional disabilities, but they may have a problem only in the area of selection of appropriate media to express themselves. The combination of vision loss and hearing loss also affects access to information. Communication is the biggest challenge for them. Children with the deaf blindness need intense support in all their needs and also need help in simple day-to-day activities. Due to deaf blindness, they affects in all around development. Ability to move around is restricted. A highly structured educational or rehabilitation program is required for them. Okay students, let us discuss about how the deafblind children are learning the concept. Children who are sighted and hearing learn a lot of through observation of other people in the family or environment behave. When we go to the fancy restaurant for the first time and are not sure of how to eat with a spoon and fork, we generally wait and watch the way of other people use the spoon and fork to eat and imitate them. This is a incidental learning. But in the case of children with the deafblindness, often do not have access or have a limited access to this learning owing to a loss of vision or restored perception. According to Van Aslan, Fetzley and Postman 2006, they stated that incidental learning is learning that takes place naturally and frequently in regular daily living activities. Concomitant disability in the primary sensory modalities of vision and hearing. Vision allows typical children with a sight to observe the world through a whole to part approach, while those with deafblindness must observe their world from a part to whole approach. It was stated by Bruce. Due to inopportunity to observe objects, movements and individuals with their eyes. For an example, the 2-year-old child learned to brush teeth by observing the elders at home, whereas the child with deafblindness will not be able to learn brushing through observation. Incidental learning for children with deafblindness is further hampered by the lack of auditory information processing from sounds and vocalizations naturally occurring in their worlds. Dear students, now we are going to discuss about the strategies for teaching children with deafblindness. Students who are deafblind have a variety of learning needs. Depending on the strength and needs of each person, selecting an individualized educational program can be a difficult and complex task. However, we must keep in mind that the overall goal of the program is to foster independent living skills of children with deafblindness. Programs for students who are deafblind have often included in training in self-care skills as a major focus of the overall curricula. The skills of dressing, grooming, toileting, feeding and doing very basic household chores have received the most emphasis. The importance of teaching self-care skills to students who are deafblind has been recognized for a long time. However, professionals often have a difficult time determining what skills to teach and what continuously mastery of the skill. In reviewing many individual educational plans, that is IEPs for them, it is evident that skills are not always taught with the mastery in mind. In an adult situation, a person is either toilet trained or not toilet trained. In selecting other self-care skills like feeding, bathing, dressing, programs are often follow a strict task analysis protocol for teaching the skills to children with a deafblind. Mastery of the skill is not always equivalent to independence. A student may be able to perform a skill in a highly structured setting, but the same student may be able to perform the task at home or in the community. The current best practice in education is to offer a functional curriculum to students with vision and hearing impairments. A functional curriculum is age appropriate, relevant to the performance in a variety of settings, reflects the impact of transition to the next environment and it's meaningful. An important aspect of the functional curriculum is the emphasis on choices and teaching in natural environment. Let us see how the deafblind children are learn to participate in routine activities. Number 1, encourage him to participate in dressing, undressing by doing simple things with the adult assistance like pulling down the t-shirt from the head, pushing the pants down till the knee or pulling them up from the knee, putting the arms through the armhole, removing the shirt when one sleeve has been removed and so on. Second thing is, children who are blind and those who have been in a ICU immediately after birth and were exposed to light for 24 hours often have a inverted sleep cycle, that is sleeping during the day and remaining awake through the night. It is because they are able to develop a sense of light, that is a day, and darkness during the night. This may cause a lot of inconvenience to the family members and also hampers their own learning process as they are asleep or cranky throughout the day. A few example suggestions may help the family. Number 1, a gentle massage may help the child in feeling relaxed and sleepy. It means a warm bath just before bedtime also helps in some cases. Second thing is, keep the lights very dim where the child sleeps and try to provide quiet atmosphere. In case of slightly older kids, it is important to communicate that it is bedtime by making them feel their pillow or a blanket and showing how others were also sleeping. Then third thing is, slowly playing soothing instrumental music or repetitive chatting may also be helpful for the children with deafblindness. We should ensure that parents do not start playing with the child or watching television with him in the lap if he is not able to sleep. Then the fourth strategy is toilet training also may not be smooth in case of children with visual impairment and additional disabilities. It may be quite some time before they learn to communicate their toilet needs. Some of them may not even show any discomfort when they are wet. Following a very regular toilet schedule, familiarizing the child well with the toilet area, providing modifications for the potty or a toilet seat in a way that the child is comfortable, safe and well supported, and we should be assuring them that you are around and will not leave him alone, giving him enough time to relieve himself, rewarding him amply both through hugs and praises as well as with the sweets. Biscuits are a favorite activity every time he succeeds, are some of the strategy which may help increasing the intake of fluids and greens in case of irregular bowel movements. Then fifth strategy is teaching independence in eating to as to start early. Then the next strategy is divide the process of eating in different steps, like eating the food from the spoon. When the spoon is brought near mouth or taking the food to mouth, focus on helping him master one step at a time, although he may be participating in the full process. The next strategy is keep his hand on your hand while you take the food to his mouth work on the various hand skills like holding with palm, picking up small things with the thumb and first two fingers, holding, lifting and putting down things using both hands throughout the day during various play and functional activities. The next strategy is scatter small pieces of food like bits of biscuits or a boiled potato or buffered rice and so on, and encourage him to pick up them and put them in the mouth. Meeting meal time challenges. Feeding in case of these children may big challenges such as refusal to accept solids, lack of chewing gum, biting, swelling, slipping skills, throwing up repeatedly and splitting out the food, being extremely irritable at meal time. Accepting only soft and smooth food items like mashed banana and pured rice dill. Okay, let us discuss why the children are not participating in the strategy activities. Number one is lack of opportunity to learn by imitation, weakness of the neck muscles and those of foot pipe. The third thing is sensitivity of oral area, then inappropriate utensil aids like spoon and slipper, uncomfortable posture, general insecurity arising out of visual impairment, then adults failure to communicate properly before and during the meal time. Then now we are going to discuss about the strategies which may help in meeting these challenges are: number one, make meal time more acceptable through proper communication. Second, prepare the young ones by giving them touch cues and by talking about what is coming, that is the name of the food. In case of slightly older children, involve them in a preparation for a meal time. For an example, laying the plates, bringing the food to the table and so on. Then the next strategy is make meal time a pleasant experience by playing soft music, singing a child's favorite songs or talking in an interesting voice about him and the food he is eating and so on. Make them familiar with the utensil. The next strategy is give importance to the child's unique way of communicating hunger and giving choices to them. The next strategy is maintain appropriate positioning and physical support. Placing the child upright is vital. Hips and knees at 90 degree is desirable for a child with a spasticity, that is, help the child experience position appropriate to their age. The next strategy is have a secure seating arrangement for a child with legs also supported. The teacher or a mother position also be comfortable and well coordinated with that of the children. The next strategy is consider muscle tone, head and neck control, grasp and release and so on, and provide special chair or a cutlery and utensil wherever needed. Reduce the food related insecurity and tactile defensiveness to children with the deaf blindness, and let the child touch the food and feel its texture. Expose him to a variety of food texture. Using trainers brush with a soft and blunt bristle, or even the adult's finger dipped in a honey or a favorite food before introducing spoon may helpful. The next thing is encourage the child to touch, mouth and play with objects with a different texture. Some more useful tips are provide good contrast and appropriate lighting. Secondly, position the food at an appropriate distance from the eye. The third thing is model and take turn in eating and include the child in family meal time. Let him be seated close to you while you eat and encourage him to feel your mouth and throat. Then provide simple oral motor exercises. The next, building up turn taking games such as lips macking, tongue clicking, bowling, licking and imitating animal sounds. It may be helpful for the child. Then work on a specific oral skills like lip closure, tongue movement or removal of tongue thrusting. So, students, you should remember that don't touch the child directly, call them if they have some hearing, just touch gently. Then second thing you should remember, don't use very hard or very soft object initially in case of very sensitive children. The third thing is do not force or push the child to move in unfamiliar environment. Then fourth one is initially don't force the child to eat very hard or very soft food items. Dear students, I hope that you understood the effects and implication of deaf blindness and activities of daily living and education. And in this section, you learn what are the strategy we should adapt and what are the strategy we should follow while teaching the concept to children with deaf blindness. Thank you.